Hello everyone, my name is Zamre Rushika Shankar and today topic for daily task is the minimum criteria for reporting. In that we discuss about the what are the minimum criteria reporting of the ADR and also for adverse event. First of all, we all know that the adverse drug effect, which are the harmful or undesirable effect which should produce by the drug, and adverse event is the causal relationship between drug and adverse event. The both terms are usually in pharmacovigilance. We all know the pharmacovigilance is the science and activity related to the detection, assessment, understanding, and prevention of the ADR. And we also know that the minimum criteria for reporting of ADR, there are four main criteria in that: identifiable patient, identifiable sponsor, uh, at least one ADR, and the suspected drug. We detail one by one in this topic. First of all, an identifiable patient. In identifiable reporter, a person who reporting the ADR, which should be identifiable, which should be essentially for the identifiable, can be healthcare professional. The reporter, which should be maybe healthcare professional or maybe physician or nurses or the patient. The reporter information should be included the name of the patient, or also includes the initials of the patient, contact information, example phone number and email. Then the another term is identifiable patient. In identifiable patient, information to link the adverse event at a specified patient. Patient detail should includes the age of the patient and date of the birth. Then the gender of the patient is also necessary, and initials of the patient ID to maintain the conformity. Then the suspected drug or the product. The name of the product or also brand name of the product, it should be mentioned. Suspected drug caused the adverse event, which drug produced the adverse event, the drug should be mentioned in the following way. Then the information of the dosage, route of administration and batch number should also be available in that report. Then the adverse event or the adverse reaction, a description of the suspected drug, description of the suspected adverse drug event and the side effect, which also mentioned in reporting. And the details includes the adverse event is the symptoms of the drug or adverse event, and onset data and duration, and outcome and recovery of hospitalization. Then important of minimum criteria report. Then we see the importance of the minimum criteria. In that we discuss the ensure the report validity. In that the present incomplete of the vague submission also mentioned. Then facility of causality assessment. We all know that causality assessment is the causal relation between drug and event to help determine the likelihood of the drug causing the reaction. Then meets the regulatory requirements to ensure that the compliance with the international pharmacovigilance standards, which should be also mentioned. The reports that do the report that do not meet three criteria may be considered invalid and are typically not proceed for further analysis. Uh, the main term of ADR, when ADR is valid, when all the four criteria which should be mentioned in a proper way, then it should be described as a valid case. The we discussed previously the what are the four criteria, that is identifiable patient, identifiable reporter, at least one ADR, and the suspected drug. Then what are the importance of the ADR reporting for safety monitoring? Defect or new or rare ADR effect, usually in the safety monitoring. Then risk management, the identify the risk factor and vulnerable populations and interactions, it should be mentioned in the risk management. Then the regulatory action, support decision like label updates, warning, or drug withdrawal, which should maintain by the regulatory action. Then then the improves the patient care, enhancing the drug awareness among the healthcare providers, our aware the healthcare providers and patients, we should maintain in the improve the patient care. Then sources of the ADR reporting, the We discuss all the things, but the main thing is what are the sources of the reporting of the ADR, which includes the spontaneous reporting, then clinical trial and post-marketing surveillance and literature reports. These are the several sources of the reporting, and this is all about the reporting of the ADR. Thank you.